Good morning. I am Dr. Tanga, Director and Professor of Pathology. I hope you are enjoying this competency-based curriculum. It will be useful to you. And you are learning cell injury and cell death in these days. You have learned about necrosis, and today's class we shall learn about another type of cell death, apoptosis. So what are the competencies you are expected to acquire? You should tell what is apoptosis. You should describe the molecular mechanisms and morphology of apoptosis, otherwise programmed cell death. And you should be able to distinguish between what you learned, necrosis and apoptosis. Give examples of conditions associated with apoptosis. Now we shall go into the lesson. Look at this picture. Can you think what it is? And is the hand appears normal? Is it an adult hand? Think when I'm talking all these things. No, it's a child's hand. Okay, what has happened here? Two fingers, they are joined together. So have you seen any animal with all the fingers joined together? Yes, frog. Okay, with the webbed fingers. This abnormality, this congenital abnormality, we call it as webbed fingers. Okay, why it's happening? Can you think? Recall your anatomy. What did you study? During embryogenesis and morphogenesis, all our fingers were webbed. And the unwanted tissue in between our fingers are removed by a process which is genetically programmed. This is called programmed cell death. So when we are born, nice newborn hands. Okay, nothing in between. So this process is called apoptosis. So many organs. You just recall your embryogenesis. Your father and mother, sperm, ovum, one cell stage, two cell stage, it goes on dividing. If it goes on, if we allow it to goes on divide, then one cell can fill the whole earth, but it's not happening. So what happens in organogenesis and embryogenesis? All the unwanted tissues are removed by a genetic program. That is, you are fearfully and wonderfully made. By that program is called programmed cell death, otherwise apoptosis. Good. Now look at this slide. There are 4 diagrams, 2 diagrams in the upper half and 2 diagrams in the lower half. Now again I am asking you, recall your anatomy. What is the organ? Upper half, both are from the same organ. Can you recall? Think what the organ could be? Lobules of small acini, big duct with some secretion inside in the first picture. The adjacent picture, all the acini have become big, lined by tall columnar cells. Almost all acini have something secreted inside. What is this organ? Breast. Okay, the first one is the normal breast. And the second one is the histology of a lactating breast. And you have seen mothers lactating. Then how will the breast become normal? They become normal after 3 years. Nowadays, you have to feed for at least 2 years. That's the latest WHO protocol. After 2 years, 2.5 years, the breast come back to normal. How? Have you ever thought of it? Yes. What happens? Then again, go back to your physiology. Recall, what are the hormones involved in lactation? Okay, so they are withdrawn. When the weaning, the hormones are withdrawn. Then the big breast with all big glands secreting milk come back, involute back to normal. How? Again, there is a genetic program triggered by withdrawal of hormones. This is again due to the process known as apoptosis, programmed cell death. Okay, another interesting, look down. I have labeled it. Both are from endometrium. What is the first picture? Proliferating endometrium. It proliferates, ovulation occurs, then secretory endometrium. Then what happens? Shedding. You call it as menstruation. Then go back for the proliferating endometrium. If you look at nature, this endometrium is such a wonderful thing. Okay, endometrium, it will proliferate and it will make a nice bed to receive baby if it is going to come. That means if the zygote is formed in the ampulla, it will come and embed in the endometrium. It will every month it will wait whether something zygote is coming, so that I can give a nice bed. That is the secretory pattern, and then decidua and all. Of course, if no fertilization, what will it do? No, I will make a new bed, shed off. How does it happen? The shedding, after shedding, coming back to again back to the cycle, again withdrawal of hormones. Why it happens, the shedding? Again, programmed cell death. All the secretory cells you see here, no? They all shed off. And then new bed, new proliferative endometrium starts. These two are another good examples for physiological causes of apoptosis. Look at this picture. First, look at the instrument which you see in the screen. Okay. And now it's not rare. Many institutes have this picture. What is it? It is not an X-ray. This is a radiation instrument. Okay. So, who gets this radiation instrument? People with cancer. Why should some cancers undergo this radiotherapy? Because the cells abnormally proliferate. So they have to be removed. Cancer has to be removed. So this radiation will induce programmed cell death, apoptosis. So it is used. This is a typical example of pathologic mechanism of apoptosis. Okay, radiation causes apoptosis so that the cancer cells, they die. Look at the next two pictures. Some people might have some relatives like this. One man, first picture, two men, below one man and probably his wife, look like that. What do you get by looking at this picture? Looks as if they are not having memory. This old man and this old woman. So all of you have heard about Alzheimer's disease. Okay, a neurodegenerative disease. Why it happens? Okay, this neurodegenerative disease, this picture is again from Robbins. You will come across frequently, so I thought I will explain it here. Due to metabolic alterations due to genetic mutations. What happens? An abnormal protein, A-beta amyloid, it gets deposited in the brain. That causes the memory loss. Why it happens? Whenever there is genetic mutations, normally the proteins are folded in endoplasmic reticulum with the help of chaperones. So whenever there is genetic mutations, whenever there is viral infections or any insult, that normal proteins, they get misfolded. So that's why we call it as endoplasmic reticulum stress. Otherwise, protein folding demand is more than the protein folding capacity of the endoplasmic reticulum. What happens when there is excess protein unfolded? Endoplasmic reticulum cannot get folded. So they trigger. Come on, you better die. The cell, you better die. So misfolded protein results in triggering of apoptosis. So this is a mechanism how Alzheimer's disease happens. Again, triggering of apoptosis. This is an example of pathological cause of apoptosis. So what is apoptosis? It's a pathway of cell death in which cells activate enzymes that degrade the cell's own nuclear DNA and nuclear cytoplasmic protein. So what happens? Nucleus is degraded as well as cytoplasmic protein. Everything is genetically handled. So until now, what we saw, what is this apoptosis? How did they get the terminology? It is from the Greek terminology, leaves, how they fall away. So a falling away from. So how leaves fall away, the apoptotic cell will, apoptotic body will fall away from the cell. That's how the name. Other name, programmed cell death, cellular suicide. I told you examples of physiological and pathological examples, causes. So embryogenesis, I showed the web finger. How involution hormone dependent, that is endometrium coming back to normal after menstruation, lactating breast coming back to normal after weaning, all by a programmed cell death. Another example, okay, every day in your intestinal epithelium, their cells proliferate, crypt proliferate, come back to normal, the proliferation and apoptosis. Similarly, autoreactive T cells in the thymus, okay, during development, if any things are there, it will be deleted by the same process, apoptosis. If it is not deleted, you will develop autoimmune diseases, which we will see later. Then I showed you pathological causes of apoptosis, how radiation causes apoptosis. Cytotoxic cancer medicine, same mechanism, they cause apoptosis. Now look into the morphology of this apoptosis. If you look at this picture, there is a normal cell, and normal cell, what happens when the programmed cell death is triggered? There is condensation of chromatin. There is condensation of chromatin. Then cytoplasm also broken, and just they are showing out, protruding out like blobs. They fall away. That's how the name, falling away. In Greek, apoptosis, that's how they name. This chromatin condensation takes place at a particular breakdown point. We will see it later. And when the cells fall away, the adjacent cells, they engulf or they phagocytose this apoptotic bodies. So, chromatin condensation, membrane blobs occur. At the same time, the cell shrinks. Okay, then cellular fragmentation, these blobs fall away, and the adjacent cells, they phagocytosis. So there is no chance of eliciting any inflammation. As soon as the blob comes, the adjacent cell will phagocytose. How is this regulated? By biochemical pathway, they control the balance of cell death and cell survival signals. How? By activation of enzymes known as caspases. What is this caspases? They are so named because they are cysteine proteases that cleave proteins after aspartic acid reduce. That means each nuclear material, whenever there is an aspartic acid residue, these caspases, they cleave it. We shall go little bit in depth molecular mechanisms, which is a must know for you in this competency. There are two pathways this apoptosis is done. One is mitochondrial pathway or the intrinsic pathway. Second one, death receptor pathway or the extrinsic pathway. So, what is this mitochondrial pathway? We saw it. Cell injury due to growth factor withdrawal, DNA damage, you have already seen, and endoplasmic reticulum stress, protein misfolding. Any types of these cell injuries, it is sensed by the cell, known as BH3 sensors. Then one group of proteins known as BCL2 family proteins. In that BCL2 family proteins, some are pro-apoptotic. When those subproteins, the groups are activated, it will cause apoptosis. Some are apoptosis inhibitors. So what are the pro-apoptotic BCL group proteins? BAX and BAC. Anti-apoptotic proteins BCL2 and BCLXL. These pro-apoptotic proteins, they act on mitochondria. The mitochondria releases cytochrome C and other pro-apoptotic proteins. This is the way this is otherwise known as initiation. The apoptotic is initiated whenever the cytochrome C and other pro-apoptotic proteins are released from mitochondria. Then, how is it executed? The caspases. So, these proteins activate caspase. This caspase in turn activate endonuclease. They go and fragment the nucleus, as well as they fragment the cytoskeleton, which we saw in the previous picture here also. So, the apoptotic bleb falls off. This apoptotic blebs, which is coming out of the cells, parent cell, okay, they have ligands for phagocytic receptors for the adjacent cell. So, the adjacent cell phagocytoses it. Coming to the next pathway, the death receptor or extrinsic pathway. This usually happens in the T lymphocytes. So whenever any ligand binds the cytotoxic T lymphocytes, these receptors like FAS, tumor necrosis factor receptor, the moment any viruses or any toxins or anything binds with these cells, straight away with the help of adapter proteins, there is no mitochondria involved in, caspases are activated. Okay, this receptors otherwise known as death receptors, FAS and tumor necrosis factor alpha factor. So when they are activated, straight away caspase is activated. Again endonuclease activation, nuclear fragmentation, breakdown of cytoskeleton, apoptotic body, and it's engulfed by the adjacent phagocyte. Is it clear? It's from Robbins. Okay, how does the cell look like? This is a picture again from Robbins. Cell shrinks, condensed cytoplasm, eosinophilic. This is from a tumor. And nuclear also shrinks and nucleus is breakdown. So what is the difference between necrosis and apoptosis? In necrosis, there is cellular swelling. Apoptosis, cell shrinks. Necrosis, nucleus is pignosis carrier. Here, it is fragmentation by caspases into characteristic nucleosome-sized fragments. Plasma membrane is disrupted in necrosis, but here plasma membrane is intact and it is just cytoskeletal fragmentation and formation of apoptotic bodies. Necrosis, you learned enzymatic digestion, but here released as apoptotic body. So the main Difference is no inflammation in apoptosis. So necrosis is only pathological. But apoptosis, you saw, it could be physiologic, eliminating unwanted cells in the body, or it could be pathologic. Okay, this is again recall. Necrosis, whatever I told you. Apoptosis, okay, one is misfolded proteins, radiation, certain infections, okay. All these things we saw in the previous slides. You can go through it, same thing in another form of diagram. Then, this is again the difference. What is causing necrosis? Toxins, radiation, reduced oxygen supply, ATP production is defeated, and production of reactive oxygen species, which all you learned already. But here we saw apoptosis, decrease survival signals, and release of pro-apoptotic proteins, decrease of anti-apoptotic proteins, mitochondrial cytochrome C release, caspase activation, and apoptosis. So, to sum up, what did we learn in this class? We learned what is apoptosis. We saw so many examples of physiologic and pathologic causes of apoptosis. We learned how apoptosis happens, molecular mechanisms, and we learned the morphology. How does an apoptotic cell looks like? And these are the references, that is Robbins Basic Pathology, 10th edition, that all of you are having this book. If you have any queries, any doubts, I have put my email in this PowerPoint, that is tanga7paul@gmail.com. You can always mail to me and clarify your doubts, your questions also, your suggestions also. Thank you so much for your patient listening.